Ciara, I very much welcome the opportunity to address the Seanad on the private members' bill and colleagues' interest in our health service and in the nursing and midwifery professions. I'd like to thank the Labour Party senators for tabling the bill, and which obviously initiated this evening's debate. And I'd like to particularly recognise the ongoing work of Senator Hoey on issues pertaining to students and the very important work that she does and that indeed her colleagues do. I'd like to take the opportunity also, as with many members of the House this evening, to acknowledge the commitment, the very real commitment of all nursing and midwifery students to healthcare and indeed to their education. I'd also like to thank all nurses and midwives and indeed all healthcare workers for their dedication and commitment as we continue to deal with the COVID-19 pandemic. It's been a very tough year, as we all know, right across the country. It's been a very, very tough year for all those in healthcare, be they students or qualified, be they doctors or nurses or hospital porters or cleaners or receptionists or managers. It's been tough. And as with many colleagues here, I've spoken directly with a lot of healthcare workers, and what they have experienced is really tough. They are working long hours. They have been under huge pressure. They have seen awful situations within the hospitals, and I think the recent Primetime Investigates report from Tallaght University Hospital really brought home I think both the level of pressure that our healthcare workers have been under and the extraordinary commitment they have, and just how fortunate we all are to have them, that they have continued to step up week after week after week to make sure that healthcare continues in this country. Student and midwifery nurses, while on the supernumerary clinical placements, that refers to the placements that are in addition to the rostered staff. These students, as we all know, they are in education. These are educational placements as agreed between their colleges and the HSE. In line with the relevant EU directive, the education is carried out on the front line as part of a team across a wide variety of care settings and carried out under supervision. That supervision is provided, of course, by qualified, experienced nurses and midwives. Students may undertake paid work while adhering to public health advice in healthcare settings, while maintaining their nursing and midwifery programme, if they wish to do so, and indeed many do. Students obtain a high level of competency over the training programme, and by the internship year, this is at a level where they can work under what's called distance supervision. Up until then, they are building that competency, and in line with education programmes, paid work is not counted towards regulated clinical learning hours and experience. And I think this is an important part of this. So in order to qualify, very specific hours are required in terms of learning and competencies as very, very highly structured. So according to the directives, paid hours don't count towards that, and that is at a European level. I note the bill refers to the settings of specific pay levels by the HSE for particular work, in this case for healthcare assistants. And while I really do understand the desire to prescribe such pay in the bill, it is important to note that pay determination in the HSE is a matter for the HSE under Section 22 of the Health Act. It's not a political act. It is a matter for the HSE under the 04 Act, and such determination is given effect with the approval of the Minister for Health and given with the consent of the Minister for Public Expenditure and Reform. In that context, it's not a matter for the Oireachtas, a specific pay issue like this, other than by way of amending legislation to the Health Act to determine pay. Having said that, as I mentioned earlier, the government is not opposing this bill, as it generally refers to pay for work, and as mentioned earlier, the government fully supports the paid work internship programme, for example, that fourth years have that are in place for student nurses and midwives. And government also fully supports the continued protection of the nursing and midwifery supernumerary clinical placements programme. So changing the supernumerary status of those placements, which essentially is what we're debating, to that of an employee, it would remove the educational protections that are so important to the learning experience. And it means they're unencumbered by an employment contract. In other words, what they are there to do is learn, which is the most important thing. And that is not to dismiss what has been a very difficult year, where students and indeed everyone across the healthcare system has stepped up. As colleagues will be aware, nursing and midwifery has been a graduate profession in Ireland since 2004. And research has demonstrated that positive patient outcomes, including lower mortality rates, fewer medication errors, are linked to a nursing and midwifery workforce that is educated to a degree level. It's a really important component of our healthcare system for the nurses and midwives themselves, but also very much for the patients. And it's important to focus on the benefits of the undergraduate nursing and midwifery programmes, which I think, as colleagues have said earlier on, are second to none. Or as the chief nurse said to me one evening when we were discussing the details of these placements, she said, the degree training for nurses and midwifery, in nursing and midwifery in this country, are the envy of the professions globally. We are recognised as having one of the best educational programs anywhere in the world for nurses and midwives. It's one of the reasons they're so highly sought after when they graduate. It's one of the reasons they're actively pursued by other countries, because they're so well trained. And the reason they're well trained is partly the hard work they put in during the program, but it's the 4-year program which was modelled on medical training, on doctor training, when it was brought in 2004. And the final year internship program is very unusual. It's a very valuable part of the programme, and whilst we may and we will agree and disagree on various aspects, I can assure colleagues I spent a lot of time, as you can imagine, on this issue over the last few months. I spent a lot of time with the chief nurse. I spent a lot of time with department officials. I spent time listening to the senior nurses, to the higher education institutes, and every conversation starts and ends with a passion from those people for education for the students. And you know, we can debate issues around pay for work and so forth, but I can tell you with absolute certainty that I am confident that the people who we charge to make sure that these students get the best education they can get within the HSE, the preceptors, as were referenced earlier on, the nursing supervisors, the qualified senior nurses who work with these students, the professors, the assistant professors, the staff in the colleges and the higher education institutes, the officials in the Department of Health, the chief nurse, and the NMBI team. There is an overwhelming commitment to ensure that these students are safe, that they are cared for, that they are listened to, and that they get the best possible education they can get to make them the best possible nurses and midwives that they can be. And I just think it's important to reflect that. We can agree and disagree, obviously, on many of the issues raised today. But at the core of everything I've seen in my interaction since becoming Minister for Health, that I have seen this commitment. It's an honour degree level programme which we know over 4 years, and unlike the UK and indeed other international degree programmes, our graduate programme includes a contractual internship with a salary for the final 36 weeks. The programme supports the optimal learning environment where students actively take part in patient care, learning through supervision. And over the 4 years, the approximate payments to the students is about €17,400 across the 4 years, and then there are additional expenses which can be claimed as well, in some cases for travel and accommodation. I'm sure every member of the House will agree that our nurses and midwives are internationally sought after, and I think, as some colleagues have said, we do want to recruit more, and actually we have put a very significant investment in this coming year into not just scaling up the nursing and midwifery workforces, but critically doing so according to the agreed safe staffing levels, which is really, really important. So we need the HSE, we need public healthcare in Ireland to be the place that our graduates want to work. And I think that's very, very important. The graduate programme really has created very exciting career opportunities, extending practice and allowing for advanced practice routes, which weren't possible before, and indeed are really being seized on by our qualified workforce. There's many opportunities for graduate nurses and midwives by way of further education, for example. The policy for the development of graduate to advanced nursing and midwife practice provides a framework for graduates to draw upon their undergraduate programme. There's a recent additional funding of 2.2 million provided for the advanced nurse practitioner and advanced midwife practitioner roles, and the numbers employed in these grades are continuing to increase, which is really important. Today's graduate nursing and midwifery students can, after 1 year and 16 weeks suitable experience, apply for the enhanced nurse midwife role. So essentially when they graduate, 1 year and 16 weeks later, they can apply to be for the enhanced role, and that has a starting salary of a little over €37,000, and then there are various allowances and premium pay in certain roles, obviously. The expert review on nursing and midwifery is also a really exciting development. It's expected to report with recommendations in the coming months to me, and it's going to be a really important milestone in the evolution of the professions in Ireland. I think it's really exciting work, and it's undertaking important work on the future of nursing and midwifery in the context of significant planned reform within our health service. Student placements in our hospitals are a vital part of the clinical learning programmes, and the clinical placements make up 50% of the programmes. As students rather than employees, supernumerary clinical student placements ensure learning takes place on the front line, supervised, enabling students to develop the practical knowledge, clinical skills and professional behaviours required for competence to qualify and be eligible to join the professional register, which of course is what we all want them to be able to do. Government wants to protect their status as students and protect the graduate programme, which has so many benefits. The supernumerary clinical placement affords the opportunity to learn in the optimal clinical learning environment. That is the view of the higher education authorities, it's the view of the preceptors, it's the view of the directors of nursing, it's the review of Professor Collins, and we'll have another review later on as well, obviously, on the placements. The placements were disrupted a number of times during COVID, as colleagues have said. In April of last year, all clinical placements were cancelled nationally, and this was in order to free up for full-time patient care, the qualified nurses and midwives who would normally be supervising the students during their placements. So I think it's just important to clarify this, Cahirla, that there might have been some impression given that the nurses, whilst on placement, were simply then were paid as healthcare assistants, that there was a simple transition. In fact, that's not what happened. What happened was all student placements were cancelled, and then the hospitals offered HCA roles essentially, and about 1 in 3 of the students applied for those. So the student placements did not transition into HCA roles at all. The student placements stopped. And then a lot of work was done to make sure that learning time was made up, because as I was saying earlier on, the time in paid employment cannot and does not count towards their qualifications. Significant recruitment across the system last year of over 6,000 staff, which included about 1,700 nurses and midwives, enabled the placements to resume for this academic year, which obviously was very important. Then, of course, we had the third wave, which we're very aware of. The HSE contacted the department and asked again that the student placements be suspended for first, second and third years. And again, that was done because it freed up several hundred qualified nurses, and in some cases very senior nurses who normally would be supervising the students. Essentially, the HSE needed them for full-time patient care. So that lasted about 3 weeks. And then because the pressure has eased, obviously they're still under huge pressure, but because the pressure has eased somewhat, we were able to put the HSE was able to put the placement infrastructure back in place, and there's now a phased return happening of those placements. I want to acknowledge the efforts to maintain placements, but there's no doubt that the education of healthcare students during a pandemic is challenging. As testimony here today, very powerful and very personal and very important testimony has been read out by many senators, and we need to listen to the students very, very carefully. It has been a tough year, and not I nor anybody else is going to try and dismiss that. It has been, and we need to recognise this. Can I just clarify that the student nurses were vaccinated? I just checked in to double check that they were vaccinated as part of cohort 2. And if the Senator or indeed any colleagues have examples where that hasn't happened, you feel free to contact me directly and I'll raise it with the HSE immediately, because they are most definitely included in cohort 2. To conclude, Caoirleach, I know I'm over time. Am I okay for a minute? I am, thank you. To further assist Thank you. To further assist student nurses and midwives on clinical placements, I appointed Professor Tom Collins to carry out an independent review of the clinical placement allowance, and that was specifically to review the placements during COVID, during this more stressful time, which we're all aware of. And the professor reported back to me on the 31st of December. He made several recommendations, but the one of focus is his recommendation to implement a pandemic placement grant, which is the €100 a week, non-tax pandemic, and he provided an option for me to backdate that to the start of September. So on a 12 weeks of placement, essentially that would be a non-taxable payment of €1,200 is the recommendation. The average number of placements is sorry, I've just covered that. I would very much like to pay this. I'd very much like to implement Professor Collins, and we have had good conversations with the representative bodies, and we will continue to have those. And if we can get to a point where there is agreement with Professor Collins's report as as a balanced response to the placements during COVID, we can implement his recommendations, obviously, straight away. I've also asked to be carried out a long-term review, and I think this is very important, of the placements and for the allowances. And this will go very much to some of the issues that have been raised here by colleagues around students being able to afford to be students. My own view is that financial barriers should never prevent someone from being a student, and we're all aware that they do at times, no question about it. Graduate training for student nurses and midwives should not be down to how much, for example, family income there might be available. So that's one of the things that's going to be looked at in the long-term review. The work has commenced, and I've asked that a report back to me in June. That'll give us some time to work with the students themselves, work with the representative bodies, the educators, and all the stakeholders to see if we can reach agreement and then implement that from the start of the academic year for this coming September. In conclusion, I would just like to reiterate that I do not underestimate the difficulties that student nurses and midwives have had over the last year. Without question, it has been a difficult time, and it continues to be a difficult time. The Department of Health and I, in conjunction with the HSE, with the higher education institutes, with the Nursing and Midwifery Board of Ireland, and with our clinical partners and representative organisations, will continue to focus on supporting our students, keeping them safe, and ensuring they have the best possible education that they can have. Thank you.